important to develop a relationship with patients showing dignity and respect. It's important also to ask them to share information with you about things that they may have heard, they may have learned, or about which they have questions, so that they feel like the communication is a two-way street. Some physicians have found that a visit preparation or assessment form can be helpful in terms of the patient putting down what their questions are, what successes they had, what things they're struggling with, and bring that with them. And for those people who don't complete it, have a visit form there in your office so that they can complete it while they're waiting, or that you can complete it with them and share some of the potential answers while you're in the visit with them. It's also important to think about what communication barriers they have. It's important to use plain language and teach back techniques to ensure you've delivered the information in a helpful fashion. Activate your staff as well as your patients to create a library of resources that other people with a condition might find helpful. And as we're talking with them, it's important to understand what their beliefs are about health and healthcare, where they're from as far as their education, their literacy level, and their socioeconomic background. We try to systematically offer brief motivational interventions to help people with the areas in which they're struggling and to allow them to move forward with more confidence. Some practices will form a patient advisory group where reading materials, educational programs, things on their patient portal can be reviewed by patients who come to the practice and be test-driven, so to speak, so that when those resources are provided, they've had some feedback from real patients. That can be very engaging, very good PR because there aren't too many physicians who actually actively ask the patients what they think, and it's a great way of getting some input from the population you serve. It's important to have those patient advisors from a wide variety of backgrounds, among people who are perhaps more economically challenged, people who are perhaps of different education levels and socioeconomic areas of the community. They can also come up with great ideas as to how to improve your service. As you're trying to become a patient-centered medical home, it's important to ask the patients what they think and what's going to be home to them. That can be a crucial element of making your patient-centered medical home successful.